Well, Beverly Hills is world-renowned for its plastic surgery and beautiful people. Reporter CONCETTA DELUCO introduces us to one Beverly Hills surgeon who goes above and beyond the call of duty to make women feel beautiful inside and out.
We've all heard the phrase medical miracles. Well, I'm at Cedars-Sinai Medical Towers in Beverly Hills, where one doctor's innovative procedures in breast surgery is taking that meaning to a whole new level.
Just started the surgery. Dr. Aronowitz had made the first incision.
He's been featured on the hit show The Doctors, and celebrities like Suzanne sing his praises.
And no scars, it's just so fantastic.
Dr. Joel Aronowitz has been a respected and successful plastic surgeon for over 30 years, but his progressive work these days with reconstructive breast surgery that's earned him national recognition and makes him the go-to guy for breast cancer survivors started out with much humbler beginnings and a woman named Diane.
She sat in my office in tears and we talked about this because even though she wasn't a doctor, she realized that the surgery she had had was way too disfiguring, way unnecessarily disfiguring for the cancer that she had.
The way Dr. Aronowitz and his colleagues fix things is by being a pioneer on the forefront of technologies and practices that focus on improving the lives of patients after the cancer is removed in ways that traditional procedures fail to take into account.
It's not good enough that a woman lives a full lifetime if she's miserable.
Often the first thought on a woman's mind when she's diagnosed with breast cancer is, how do I get rid of it, without thinking of the cosmetic side effects. But thanks to Dr. Aronowitz and his innovative procedures, he's given women a lot more to think about these days.
We have a lot of different techniques that allow us, with planning ahead of time and cooperation with the breast cancer team, to produce a result that is both effective in treating the cancer and allows the woman to have a natural breast that's not painful, that she can be happy with.
Such techniques include day of procedures that can be performed in outpatient centers as opposed to hospitals, like nipple-sparing mastectomies, where the breast tissue is removed but the skin remains intact, making it a perfect candidate for successful reconstruction. Or intraoperative radiation therapy, of which Aronowitz and his team of colleagues were the first in Los Angeles to use the new technology. Traditional radiation therapy involves what Aronowitz calls unnecessarily treating the entire breast, which harmfully affects the organs behind it and results in a hardened, shrunken breast over time, a problem that Suzanne sought resolution for from the doctor.
With IORT, we can provide radiation not only in a very brief, convenient time span, but the radiation is only going to that specific area and it doesn't affect the whole breast.
To treat Suzanne, Dr. Aronowitz turned to the work of his university's Stem Cell Center, which specializes in the practices and studies of using a person's fat cells to replace and generate tissue.
She was very happy. We regenerated fatty tissue in her breast and improved the radiation damage by injecting a mixture of her own fat cells with her fat-derived stem cells.
While Dr. Aronowitz can fix most deformities created by sloppy surgeries and radiation, he says the real solution comes from prevention. He founded the Breast Preservation Foundation 3 years ago to educate and make women aware of their options before they are diagnosed.
Well, I went into medicine because I thought it was a good idea to try to help people, and that's my basic motivation.
Bringing you the best of California from Beverly Hills, I'm CONCETTA DELUCO with California Life.